The risk for colon cancer is multifocal. As I mentioned, there are a multitude of genetic factors that play a role, but acquired factors also have a major role in development of colon cancer, and we're going to go through some of those today. They include dietary factors, lifestyle factors, as well as other comorbid medical conditions. So, how do I identify a patient who's at high risk for colorectal cancer? Really, it's with one simple question, and that is, do you have a family history of colon cancer? All too often, physicians in their busy practices may not have an opportunity to actually get an adequate pedigree on a patient's family history, and this can be the clue to really the early development and the early diagnosis of colorectal cancer in a patient. So what are those risk factors? Well, they include a personal or family history of colorectal cancer or polyps, a personal history of inflammatory bowel disease like Crohn's disease or ulcerative colitis, a personal history or family history of other types of cancers, such as uterine cancer, ovarian cancer, and even stomach cancers. These often misunderstood other types of cancers have a direct link at times to colon cancer as well, and we'll go through that a little later in the talk. Family history of genetic cancer susceptibility syndromes such as familial adenomatous polyposis or FAP, or Lynch syndrome, which was formerly known as hereditary non-polyposis colorectal cancer, also play a major role as a factor in the development of colon cancer. So this is how the pie of colon cancer basically breaks down. Thankfully, the vast majority of patients are those at average risk for colon cancer, about 3/4 of those patients. And what that really means is that they don't have necessarily an increased risk for colon cancer, but unfortunately in their lifetime they develop colon cancer, and this is called sporadic colon cancer, meaning they have no personal comorbidities that would increase their risk, and they have no family history that would give you a clue as to their increased risk for the development of colon cancer. There are other people that also make up this pie. The biggest group would be patients that just have a family history of colon cancer, and that's about another 15 to 20% of patients that have one or maybe multiple family members who have a history of colon cancer. The other probably very interesting group are the two that I mentioned. One is Lynch syndrome and the other is familial adenomatous polyposis. They occupy about 5% in total of those patients who develop colon cancer, and they are at an increased risk for the development of polyps. And we'll go through the very interesting phenotypic characteristics of these syndromes as well. When we think about clustering of cancer in families, that's really what gives us a clue to thinking that perhaps there's a genetics at play in the development of colon cancer. So in the general population, there is a 7% lifetime risk of the development of colorectal cancer. But about 20% of patients actually have colorectal cancer, and there's another family member that has a history of colorectal cancer. As I mentioned, 15% of this may just be familial, and there are probably other factors that play a role in these patients, such as environmental factors, perhaps just chance or bad luck, undiscovered gene mutations, but generally in patients that just have one family member of colorectal cancer and they also develop colon cancer, usually they're not really good candidates for genetic testing. However, in approximately 5% of those patients that have colon cancer, hereditary risks actually play a role. And these are caused by an inherited gene mutation that puts them at significantly increased risks for colon cancer. The majority of these patients have something known as HNPCC, or hereditary non-polyposis colorectal cancer. It's named after a physician by the name of Dr. Lynch, and it's now known as Lynch syndrome. And there's a smaller fraction of patients that have familial adenomatous polyposis or other rare cancer syndromes. And these very interesting polyposis syndromes may be eligible for genetic testing. Just to talk again about family history of colon cancer, if you look at this chart, and some of this data came from Sid Winworth's study from New England Journal of Medicine that touched upon the risk of developing colorectal cancer if you had family members who had colorectal cancer. So you can see here, if there's no family history of colorectal cancer, the absolute risk of developing colon cancer by the age of 79 is only about 4%. However, if you have one family member, which is a first-degree relative with colon cancer, the relative risk goes up to 2, and the absolute risk by the age of 79 is already 9%. But now look at what happens if you have more than one family member. The risk goes up to 16%, and it stays there, especially if the family members are young. So just by asking about any family members, especially first-degree relatives, mother, father, makes a major difference in the way that we would think about a patient and changes our understanding of how we actually should screen patients.